I rise with a heavy heart because, like others, I know that this is just a start of the National Government's agenda in relation to accident compensation, and they have and are continuing to try and deliberately undermine confidence in ACC and to manufacture a crisis and then flow that on to the sort of changes that the ACT speaker just referred to, the previous privatisation of ACC. We oppose this bill, except for the extension of full funding for historic claims. But before I speak about some of the specifics of the bill and some of the submissions to the Select Committee, I just want to make a couple of contextual comments. I want to note that there has been a scaremongering campaign, and there's been, of course, the inflated levies consultation campaign. Then, of course, there's been the cancelled falls prevention program for the elderly. That's a good one. There's the 20k travel and petrol reimbursement threshold on carers. Or how about the cuts in car and home modification budgets, denying half of the claims for surgery after injury, and denying sexual abuse victims and survivors counselling in at least 70% of the cases. I also find it very interesting to read in a report recently released to Labor under the Official Information Act that talks about ACC having moved too far towards a customer focus, and that there was a need to tighten the gateway by reducing the level and costs of treatment provided, especially rationalising the range and services available. So this is the context in which this is happening. Where is, as my colleague Darian Fenton said, where is the focus on injury prevention? I've sat through and listened to the Minister in the House and in the Select Committee. Where is the focus on injury prevention? It is not there, and that should be the thing that in this House we agree we need to focus on. And I would note that there's been cuts in training for health and safety representatives, from 6,000 to 2,000 representatives being trained. That is just crazy. These are the people who, in their own voluntary capacity, make it their job to make sure that their workmates, themselves and the public are safe. That is just crazy. I want to talk about the fact that a lot has been made of the costs of ACC. And PricewaterhouseCoopers reviewed ACC in 2008, and they identified a number of major points, including that it has afforded New Zealand's society and economy 4 decades of added value and social economic value, that it compares with other workers' compensation schemes and performs well in terms of return to work, that as a proportion of wages it's substantially lower than in comparable Australia worker compensation schemes. And in our minority report, you will see, if you take the time, the figures that show that comparison. New Zealand has lower claims management expenses than all Australian schemes. Our dispute rate in comparison to others is very low. Overall, it performs incredibly well. So these are some of the facts that need to be put into the mix here. I'd also want to acknowledge, as others have, the submitters. The 133 submissions we had from interested groups and individuals, and 47 of those that we heard. I want to acknowledge those people for taking the time to share, in many cases, their own personal experience, and many of them were actually first-time submitters, and there were some incredibly powerful and moving submissions made indeed. I also would like to take the opportunity to acknowledge the officials that worked with us on the Select Committee, because certainly we asked for a lot of information, we were challenging and questioning all the way through, and they continued to provide us with that information. But I'm sad to say that despite the efforts of the submitters, who were overwhelmingly opposed to what the government is doing here, they really didn't get listened to. That there are only minor changes to this bill. None of the very real concerns that were made have actually been changed, and this is what you are seeing now with this bill coming back into the House. Arrogant government, indeed it is. Now, one of the factors that I want to follow up on is the question of fairness. Fairness is something that Labor values very highly, but inequity does not seem to worry this government. And it seems to me that the Minister would be interesting to know how the Minister believes that the strategic priority of ACC to ensure New Zealanders have confidence in ACC and the strategic priority of open and fair access, how indeed he can align that with the fact that the advice given by Te Puni Kokiri that the impacts of the proposed changes are likely to have a disproportionate effect on Māori, as Māori are more likely to be employed in high-risk jobs, be from low-income families and have higher rates of imprisonment. Or indeed, the fact that there's been no gender analysis done of the proposed changes, despite the fact that it's clear there will be disproportionate impacts on men and women. And the National Council of Women, in their submission, made a great point of that, and they said women are more vulnerable to negative outcomes through a lack of social services, and stringent reductions set out in the bill will reduce those services further. In addition, many of the service providers, the counsellors, the physiotherapists, the home care workers, are women, and they depend on ACC funding to deliver these services. So a disproportionate effect on Māori, a disproportionate effect on women. Furthermore, and I'm going to go into this in a bit more detail, there's a disproportionate effect on the elderly. The elderly will be particularly affected about the provisions around a 6% hearing loss requirement before people can get assistance. And that one is one I'm going to go into in some detail, actually. I was very impressed with the submissions in the area of hearing loss. It's fair to say that they were strong submissions made by a range of individuals and organisations who work in this area. Essentially, the view of all of the submitters around hearing loss was that that figure is an arbitrary one, and that this leads to a breach of faith which will, and officials have confirmed this, so I repeat it again, will return the right to sue in New Zealand. Now, how much debate has there been about that? This is a very, very serious matter as parliamentarians that we should be worried about. We have had a scheme where there was a social contract, the right to sue was given up because the Woodhouse principles were met and we had cover. And where we have cover, we cannot sue. It is clear that a number of workers will now no longer have cover because they fall below that 6% threshold. They can sue. Is that what we want in this country? The amount saved by this provision, estimated to be $3 to $4 million a year. There's a voluntary industry accord that's been happening in this industry, the hearing industry, that saved at least $10 million in 18 months, and yet those players were not even consulted about the changes prior to them being put into this bill. Academic studies that we heard about in submission show that there will be very likely to be a trend downward in successful workplace hearing loss claims because we are now getting better at protecting people. So it's older people, it's people who've already been in the workplace, people who have suffered from working in primary industries, in the meat industry, in farming and shearing, those sorts of industries, who are going to get disproportionately hit here. Now, I could give you many examples, but I am running out of time, so I just want to really reinforce the fact that these older New Zealanders are like the man who came to us and talked about the fact that with even mild hearing loss, it can affect your relationships with your family, your friends and your workmate, that he asked us to think about what it would be like to not be able to hear the birds singing, and what would it be like to not be able to hear your grandchildren talk or to hear clearly on the telephone. This is what this bill will do to older New Zealanders, and I think that is an absolute disgrace. The Human Rights Commission came to us and said they believe this provision to be discriminatory. They said 6% hearing loss threshold before being eligible for treatment amounts to intra-ground discrimination, as it imposes different criteria for those claiming compensation for hearing damage as opposed to other forms of injury. So it is discriminatory. Does this matter to the government? No, not at all. No, despite very powerful submissions, they're not listening. I'm sure they can hear, but they're certainly not listening. Then we could get on to vocational independence, although I'm sure I'm going to be told soon that I have little time to speak, so perhaps that will be for next week. So in conclusion, I do say this is just a start, that along with clear operational culture changes, we are seeing a process of reducing cover, increasing costs, and moving to a privatised insurance model. Thank you.